Same disclosures, different objectives. I have a personal interest actually in both, several of these topics. One is the wedding, because I have a daughter who just got engaged. I have actually 3 daughters, so I'm afraid they're all taking notes. And if I'm a little verklempt today, it's because I saw the pomp and circumstance, and I'm worried that I'm going to have to match that in another year or two. The other is that all my children are hypermobile, though fortunately they don't have any other stigmata of other diseases, and we've checked, which biases me, because when patients come in and they're diagnosed with Ehlers-Danlos and they have pain and they say, oh, and it's because I'm so flexible, and I examine them, I have a hard time not shaking my head saying, you're not that flexible, because my children do all these things. So anyway, we'll talk about what they do. So this hypermobility, we'll talk about the definitions, but people will come in and they'll have joint pain, they'll have diffuse pain. It can be associated with connective tissue diseases, but not always, and that's where we have to think about it. So the first part is, well, are they hypermobile? And there's a Brighton criteria, and we'll talk about it, but basically these are the pictures that go along with it, that can they easily bring their thumb to their forearm? Can they easily, typically this is demonstrating a hyperextension at the MCP joints, but usually it's just even the 5th finger going to 90 degrees. Bringing their hands to the floor. I was just at a sports medicine conference up in Boston. There was a conference on dance medicine. They said, well, every dancer gets this one. So they all start out with 1. And we'll talk about the number you need. The hyperextensibility at the elbows, and then hyperextensibility at the knees. If you have children in middle school or high school and you watch cheerleaders, they all stand like this in the lower position. This is a little bit more extreme, but you will see that genu recurvatum. So this is in your handout. The Brighton score is up to 9, so 2 each for the thumbs, the elbows, the fingers and the knees, and then 1 for the back. If you're over 4 or 5, depending on the criteria, then